We're here at the Castlemaine station today, waiting for junior doctors and medical students to take them around to Castlemaine, Maryborough and Kyneton to show them what it would be like to work in the clinics as well as in the hospital, supporting people doing anaesthetics, emergency and obstetrics.
I've travelled up here from Monash University in Melbourne today. I'm very interested in rural general practice, so I'm really excited just to get a feel for the towns and see what it'd be like to work here.
I'm a GP obstetrician, so I work 3 days a week in the clinic and attend on average about 30 births a year.
I'm really lucky in my supervisor. Ronnie's excellent at taking care of the whole of me and making sure that I'm learning not just academically, but I'm growing emotionally.
The best thing about being a rural GP is being that part of the community, having a sense of being part of the community, being faced with all the variety and the challenges of all illnesses over all ages and all stages of life.
In a rural area, you take on so many more roles. You have an opportunity to sort of expand your skills in so many different areas.
It was really cool to see sort of the local legends and come to understand why they are loved locally and why these professionals have such a good reputation.
As first year students, we didn't know anything about GP obstetricians or GP anaesthetists, so just looking at all the little minor surgeries you can do and the variety you can get in a rural experience as a GP is just something that really surprised us.
What left me really inspired is just meeting all the local community people and seeing how involved clinicians can be in their local community, and being able to have that work-life balance and being connected to your surroundings and nature.
This is a great place to bring up a family. This is a great place to think about establishing your future.
I think I've always been attracted to being a rural GP. Most rewarding is the connection with people.
That's something that I guess I underestimated before I came here, that I would be someone in the community. I feel I have a special role to play and I'm embracing that.
My highlight of the day was really getting that feel for these smaller communities, the opportunities to practice here in such a diverse range of roles and what you can experience from being able to work in these excellent facilities, doing interesting procedural skills in a hospital, to being really grassroots, integrated into a community, taking part in something like a community garden, growing fresh fruit and vegetables with people who might be your patients as well.
We've had many students here, and it is absolutely rewarding to see how many of them are expressing the wish to one day come and do what we are doing.
After touring around all the towns today, it left me really inspired to continue to look into and pursuing a rural generalist pathway.
What a wonderful day, and to have the students with so much enthusiasm come and see that their career could be everything that they want it to be.
I wouldn't think about doing anything other than living and working rurally.